Thank you, Chairwoman Fox, Ranking Member McGovern, and members of the committee. I'm here today to offer two critical amendments. First, to strike Section 44-111 and preserve the current 10% state cost share for Medicaid expansion, preventing the financial burden that will otherwise fall on states and safety net hospitals. Second, to strike Section 44-126, which targets and defunds community health centers that provide family planning services. Taken together, these provisions in the underlying bill, in addition to the massive cuts to Medicaid that this bill ensures, would decimate access to care for millions of Americans, particularly low-income women, children, and seniors. As members of the majority attempt to shove this bill down the throats of the American people, and frankly, some members of their own party, in a process that started in the middle of the night while America slept, my Democratic colleagues and I are here to stand up and shed light on what you're hoping to hide from the American people. As an occupational therapist myself, the husband of a physical therapist, the son of a nurse, and the representative of a community with 285,000 people who depend on these services, including 110,000 children, let me focus on what's at stake with the Medicaid provisions outlined in this bill. Since the passage of the Affordable Care Act in 2010, nearly 25 million Americans nationwide have gained access to care through the Medicaid expansion. That means moms have access to prenatal and postnatal care, children can get regular checkups, and people struggling to put food on the table can still see a doctor before minor issues become emergencies. It means those in rural areas, often far from major hospitals, can visit clinics, access telehealth services, or get prescriptions filled without having to travel hours for basic preventative care. States that expanded Medicaid saw the uninsured rate among low-income adults decrease by more than half. It is so popular that even in states where the legislature and governor opposed it, like Oklahoma, when put to the voters, it was approved. In New York, the state I represent, expanding Medicaid has given over 1 million people access to care. With this bill, New York will face nearly $1 billion in new costs, while other states could see their expansions repealed entirely. As I've been here since the wee hours of the morning, participating in a broken process that started at 1 a.m., I cannot fathom why members of this majority would choose to rip life-saving care away from your own constituents in the name of tax breaks for billionaires, aside from the fact that the president told you to do so. As an occupational therapist, again, I've worked with patients, young and old, people who rely on Medicaid for necessary care. I've seen what happens when patients delay care because they cannot afford it. Minor conditions become chronic, emergency room wait times lengthen, and hospitals cannot absorb the cost. As a result, our healthcare system becomes destabilized. In cutting Medicaid, we don't eliminate the need for care, we just eliminate access to care. And for those who aren't on Medicaid, we only make care more expensive and harder to get. We force families to choose between medicine and groceries. We push more patients into overcrowded ERs, and we risk lives. This Republican bill does not save money, and it sure doesn't help the people who sent us here to represent them. It shifts the burden to states, to hospitals, and to the people who can least afford it. Simply put, it's cruelty. My amendments protect Medicaid expansion programs and ensure that millions of Americans don't lose the care that they need, and that our public hospitals and safety net systems can continue to function. Without our Democratic amendments, this bill will make all Americans less safe and healthcare less accessible, particularly for our most vulnerable citizens. I urge my colleagues to support these amendments. Healthcare, we know, is not a luxury reserved for the few, and it shouldn't be. It is a right, and it is our responsibility to protect it. I yield back.